It's really an honor to me be part of this webinar, because in this same day, I can see presentations of great professors that I read a lot of his work, like Professor Kobayashi, Dolenk, Brochi, and Matsushima. I will speak about the surgical anatomy of anterior cerebral artery, but my lecture will be devoted to residents and young neurosurgeons, because it takes to me a lot of time to understand the three-dimensional anatomy of the cerebral vessels, because we can see it in the same way, the surgical anatomy, the arteriography, and the cadaveric anatomy. So it takes a lot of time to me to understand all of these kinds of anatomy. So my goal is give young neurosurgeons and residents some applied tricks applied to arteriography and surgery. So first of all, the anterior cerebral artery originates from the bifurcation of the internal carotid artery. And the artery have a circular trajectory around the corpus callosum and in relationship with the internal surface of the hemisphere. In this trajectory, we can recognize 5 anatomical parts from A1 to A5. A1 is the part that goes from the origin of the artery to the anterior communicating artery. A2 is the subcallosal part. A3, the precallosal part. A4 and A5, the supracallosal part. A4 is the proximal supracallosal part, and A5, the distal supracallosal part. And in this trajectory, and from all of these parts of the artery, we can recognize these branches that the artery gives. This is taken from the article of Perlmutter and Rotten. It's a very beautiful article. So in this specimen, lateral view of left hemisphere, we can recognize here the carotid artery, middle cerebral artery, and the anterior cerebral artery. Here, the A1 segment from the bifurcation to the communicating artery, A2, infracallosal or subcallosal part, A3, precallosal part, A4 and A5, supracallosal part of the artery. Let's see every part of the artery. The A1 part gives rise to the medial perforator arteries. We can recognize 1 to 11 arteries. This is taken from the article of Rosner and Rotten. And these arteries goes to the head of the caudate, the internal capsule, specifically the anterior arm, and the GPI, and have some variations that we will see. This is an inferior view of a brain. We can recognize here the anterior interhemispheric fissure, optic nerve, optic chiasm, optic tract, olfactory tract, the uncus of the hippocampus, the anterior part of the uncus, and here we can recognize the anterior perforated substance. The carotid bifurcation is located here, and the anterior cerebral artery from its origins go forward and medially to reach the anterior interhemispheric fissure. If we can see through the brain, the anterior perforated substance is located here in this region in relationship with the caudate, the head of the caudate nucleus, the anterior arm of the internal capsule, and the GPI. So this is the territory of the perforator branches of the anterior cerebral artery. This is a superior view of the skull base with the clinoid process, the optic nerve, the optic chiasm, the internal carotid artery, the bifurcation of the internal carotid artery, middle cerebral artery here, and A1 segment here, communicating artery here, and the relationship of the A1 segment with the optic nerve and the optic chiasm. Another specimen, we retract the optic chiasm, and we can recognize here the lamina terminalis, internal carotid artery, A1 segment, anterior communicating artery, and all of the perforators that go to the anterior perforated substance and the preoptic area and the lamina terminalis area. This is another view with the carotid artery, olfactory tract, optic tract here, A1 segment, the perforator arteries here, and the relationship of A1 segment with the gangliobasal region, head of the caudate nucleus, the ventricle, corpus callosum here, and the anterior arm of the internal capsule here. This is a microscope view of the carotid bifurcation with M1 segment, A1 segment, communicating artery here, optic nerve and optic chiasm, the lamina terminalis region here, and all of the perforators going to the anterior perforated substance and the preoptic area. This is the territory of the perforator branches of A1. And Professor Rotten teach us that all of the perforators originate from the superior or posterior surface of the anterior cerebral artery. So we can work safely in the inferior surface or anterior surface of F1 if we need to dissect this area in vascular surgery. So again, carotid artery, anterior cerebral artery, and I want to tell you that it's very difficult to identify A1 segment in arteriography, but in the lateral projection because of the direction of the artery. So we can see here the A1 segment, but it's very difficult to identify. It's very easy to identify A1 segment in the frontal projection. We can see here carotid artery, middle cerebral artery, A1 segment, communicating artery, A2, A3, and A4. And we can recognize here carotid artery, A1, A2, maybe A3, and all of the perforators going to the gangliobasal region. Variations we can find is mainly hypoplastic A1 segment and fenestration. I have no cases of fenestration. I will show you only one case of hypoplastic A1 segment. This is a lateral carotid angiogram. We can identify here ophthalmic artery, posterior cerebral artery, and all of the branches of the middle cerebral artery, but we cannot see here the pericallosal artery, middle cerebral artery, and we cannot identify here the pericallosal artery or the A1 segment. But in the opposite side, carotid artery, A1, and the two pericallosal arteries. In this aneurysm case, I cannot identify A1 segment, but I lost the photograph, sorry. The A2 segment is the subcallosal segment. Give some perforator branches, the recurrent artery of Hefner, and two cortical branches named frontopolar and orbitofrontal arteries. We can see here A1 segment again, the recurrent artery of Hebner. This is also the recurrent artery of Hebner, believe in me. And the A2 segment is here in the anterior interhemispheric fissure. This is the orbitofrontal branch, and this is the frontopolar artery. These arteries are in close relationship with the gyrus rectus, so we need to respect these arteries if we have to perform a gyrus rectus resection. The recurrent artery of Hebner is a very interesting branch because it can have some variations. For example, here we can recognize the artery originating from the pericommunicating area of the anterior cerebral artery. And the trajectory in this case is an L-shaped artery, L-shaped. But in this case, we have an inverted L-shaped artery. The recurrent goes in this direction and turn to the anterior perforate substance in this case. So in this case, the artery have a relationship with the gyrus rectus. I published this in the Uruguayan Journal of Clinical Anatomy in 1999. This is a very old draw in which we can see 4 variations in the recurrent artery. First, the L-shaped artery. Second, the direct artery. Third, the recurrent artery. And fourth, the inverse L-shaped artery. The territory of the branches of A2, we can see here the territory, the basal surface of the frontal lobe, and the internal surface of the frontal lobe, and a part of the preoptic area with the perforated branches. We can identify a lot of variation, but I will speak about 3 variations of the A2 segment: the azygos artery, the third pericarosal artery, and the middle accessory cerebral artery. First of all, the azygos artery. We can identify here the carotid, here the carotid, A1, the recurrent artery, and here only one pericallosal artery. This is the azygos anterior cerebral artery. Here we can identify branches to both hemispheres. And here an arteriographic case: carotid artery, middle cerebral artery, A1 from one side, A1 from the other side, and the azygos artery here, divided into 2 pericallosal here. Another case that we published in the Argentinian Journal of Clinical Anatomy: A1, azygos artery, and here the bifurcation of the azygos artery. This case was associated with brain vascular malformation. The second variation, the third pericallosal artery, called by Lasortes as the median artery of the corpus callosum. We can identify here A1, pericallosal artery here, the right pericallosal, the left pericallosal, and here the middle artery of the corpus callosum, or third pericallosal artery. And here we can identify an arteriographic case with one pericallosal artery here, one artery here, an aneurysm, and the third pericallosal artery or middle callosum artery by Lasortes. This is the third variation. In this case, the accessory artery of the accessory middle cerebral artery takes its origin from A1, but in general, it takes its origin from the pericommunicating artery zone, or maybe A2 is a branch that takes its origin from the anterior cerebral artery, but its territory is middle cerebral artery territory. In this case, we can identify this branch going to the insula. And this is not a beautiful anatomic specimen, but we can identify here carotid, the optic chiasm, A1 from one side, A1 from the other side, the anterior interhemispheric fissure, the middle cerebral artery here, and this artery going to the insula in front of the middle cerebral artery. This is an accessory middle cerebral artery taking its origin from the A1, A2 transition. The A3 part is the precallosal part and give rise to callosomarginal artery and internal frontal arteries. In this anatomic specimen, we can identify here A2, we can identify here A3, and in this case, we can see from the right side, the callosomarginal artery here, originating from the A3 part, and we can observe here a variation. This is a common trunk between the three internal frontal arteries, anterior, middle, and posterior anterior frontal arteries, with a common trunk with the paracentral and internal parietal artery. But in the majority of cases, these three arteries, the anterior frontal, the internal frontal arteries, take its origin from A3. This is an arteriographic case in which we can see here the origin of the callosomarginal artery from the transition of A2, A3. This is another arteriographic case in which we can identify here ophthalmic artery, posterior cerebral artery, and the anterior cerebral artery in the entire trajectory. And we can see here frontopolar artery and the three internal frontal arteries, anterior internal frontal, middle internal frontal, and posterior internal frontal. And here, a common trunk from the A4 part. We can identify here the paracentral artery and the anterior internal parietal artery.
Professor Martinez, 2 minutes.
2 minutes, okay. 2 minutes, okay. This is the territory of the internal frontal arteries, the internal surface of the hemisphere, but also the lateral part of the superior part, of F1. We can see here, this image is taken from Las Ortes when the internal frontal arteries can have anastomosis with the branches of the middle cerebral artery here. A4 and A5, we have seen the paracentral arteries and the internal parietal arteries. This is a picture taken from this beautiful article of Rotten with all of the branches of the anterior cerebral artery, frontopolar, anterior frontal, middle frontal, and posterior frontal, paracentral arteries here, internal parietal, and the posterior pericallosal artery. Again, an anatomic specimen, and again, an arteriographic specimen with all of the branches of anterior cerebral artery. So the territory of this artery is the frontal lobe mainly, orbital and internal surface, the corpus callosum, and caudate, head of the caudate nucleus, the GPI, the anterior arm of the internal capsulus, hypothalamus, and preoptic area. So we can see here, and here, the territory of the artery and the branches go into the preoptic area. This is A1, optic nerve, and lamina terminalis. So thank you very much for your attention, and thank you, Imad and Vladimir, for the invitation to this webinar. It's really an honor to me to be here with you.